Well, Ontario's health minister is telling regulatory colleges for nurses and doctors to develop plans more quickly to register internationally educated professionals. Minister Sylvia Jones sent the directives to the College of Nurses and the College of Physicians and Surgeons, telling them to make every effort to register those nurses and doctors, quote, as expeditiously as possible. Jones is giving them 2 weeks to report back on how they'll accomplish this. Nursing groups and critics say the move falls short of the Premier's promise to do everything in his power to address a hospital staffing crisis. Let's turn to Hospital Row right now, where we find CP24's Arda Zakarian this morning to get more on what healthcare unions and professionals are going to be pitching a little bit later this morning, Arda.
Yes, that's happening at 11 o'clock in the morning. But right now, I'm actually going to bring in Dr. Alan Grill, who is the Chief of Family Medicine at Markham Stouffville Hospital. Thank you so much, Doctor, for being here with us.
Good morning.
Good morning, Doctor. May I ask you, what do you think of the Minister of Health's new initiative, the one that is going to register internationally trained nurses and doctors as soon as possible and provide them the support that they need in order to be up to date on Ontario standards? Do you think that this is going to make a difference?
So thanks so much for having me this morning. You know, I think that the fact that we're starting to have more concrete discussions about solutions is definitely a step in the right direction. And I think that if there are internationally trained healthcare providers available in this province to work in our healthcare system and do what they were trained to do, what they enjoy to do, that's definitely a step in the right direction. It's not going to be enough on its own. Obviously, there's other things that have to go along with it that you have to work into it, right? We need these staff to be part of mentorship programs so that we can ease them into these work environments so that they, get a good welcome, they get oriented to the environments that they're working in. We need other incentives, whether it has to do with salary or benefits. Other provinces have started to do that as well in order to attract and retain more staff within our healthcare system. And I think we also need things like mental health support. I mean, there's been a lot of burnout regarding the pandemic, and the pandemic is still here. It's not going away. So these are some of the things that we have to incorporate into these types of solutions, but I'm glad at least that we're moving in that direction.
The Ontario Nurses Association says that there's a new report from Statistics Canada saying that there's 45,000 vacant healthcare positions in Ontario alone. When you hear this number, what are your thoughts?
Yeah, I mean, it's definitely concerning. I mean, we want people to work in healthcare. I work in healthcare. Those of us that are in it are doing it because we really like helping patients. We really like helping our communities. And we need strong, enthusiastic people, obviously, to work. And if we have all of these gaps, that's going to have an impact. And I think part of the problem when I hear that number is, you start to see these cracks in the system. I mean, closing emergency departments. I mean, we're a publicly funded healthcare system. This is the last thing we want to see. We take pride in the fact that we have care available to anybody that needs it, across Canada, especially in Ontario. When people have to travel extra distances for care, we start to worry about healthcare outcomes. What's going to happen if care gets delayed? And then obviously when we hear stories about long waits in the emergency department, that's not the type of, customer service that we want to give patients. We want to get to them quickly, triage them properly. And that becomes much more challenging when you have staffing gaps and numbers like you just mentioned.
Dr. Alan Grill, thank you so much. Dr. Alan Grill is the Chief of Family Medicine at Markham Stouffville Hospital. We appreciate your time.
My pleasure.